Hello students, today we will discuss one common clinical condition which is very interesting also. We'll just see this one, what this condition is. So have a look, it is in the ear, what all possibilities, have a differential diagnosis which we can have. Just think. Look at that, differential diagnosis, it is keloid. Mostly it is keloid. Keloid can occur in the ear. It is different from the hypertrophic scar, that keloid where scar tissue is proliferates beyond the normal scar margin. Scar tissue continues to proliferate more than 6 months, and it is vascular, it is deep color, and it can cause itching, pain also. It even after excision also it may restart. Recurrence rate is very high. That is the difference between the hypertrophic scar and the keloid. Keloid is one of the possible. Other possibility is dermoid ear. Ear is made up of 6 tubercles. It is a tubercles. So wherever these tubercles fuse, dermoid ear can occur. So there is other possible differential diagnosis you have to think of. One more differential diagnosis you have to think of is the soft tissue of the ear, soft tissue tumor of the ear. So what is keloid? It's exhaustive definition of type 3 collagen. This is important. Remember, it's an MCQ question. Type 3 collagen. Beyond the ear margin more than 6 months. It is black, pinkish, tender with itching and is hypervascular. Unlike hypertrophic scar is less vascular or avascular. Common in blacks, genetically predisposed. That point also you have to remember. So keloid is common over the sternum, over the shoulder lateral, or the arm lateral aspect below the shoulder, and over the chest wall, over the ear, and so on. So these are the common sites of keloid. Again, MC question, sternum is the commonest site, remember. Then chest wall, upper arm, ear. That point also you have to remember. It's a type 3 collagen. That point is very important. So what is the treatment? What is the problem? Problem is pain will be there, hyperesthesia will be there, itching will be there, and it is a vascular. So it increases in size. It's cosmetically doesn't look nice. So in this area, cosmetically, in this area, cosmetically it's a bad lesion. So that's why it does not turn into malignancy, but that's why it is symptomatic and cosmetically not good. That's why it requires a treatment, but treatment is difficult. Now what is the treatment? Intrakeloidal injection of the triamcinolone steroid. That is the ideal treatment. Intrakeloidal excision, laser, 5FU method interference can be used. And excision and suturing will cause high recurrence. Just excision should not be done. Ideal is intrakeloidal injection. Triamcinolone injection can be injected along with the xylocaine solution into the keloid. Usually once in 10 days, 4 to 8 injections will give it regresses. And after giving injection, intrakeloidal you can exercise and continue the injection. Only important thing is you have to tell the patient that recurrence is very high. Even if you exercise it, once it looks good, but it recurs. So because genetically they are predisposed, kidney is not normal. That point you have to very clearly tell, otherwise they will unnecessarily cause problem. And so many treatment methods are available, but finally recurrence is very high. What is important is you have to know the differences between the hypertrophic scar and keloid. Hypertrophic scar, keloid, differences between these. You should remember, one is for 6 months, one is beyond that, one goes beyond the margin, one is within the margin, one is vascular, one is not vascular, and one is not that cosmetically worse. Like that, treatment differs, all those things you have to remember. For that, you can always go through my clinical book. It also shows my SRB's manual of surgery, gives a table and in detail about the keloid. Please go through that so that you will have the very clear idea. It also gives about the hypertrophic scar, what are the differences, everything. And surgical operations, you can go through my book in detail. It is there. And tissue approximation also you can learn with video how to do suturing and different types, all those things it is there. And my DigiNow, everything it is covered. Basic clinical examination to different chapters in detail with the brief operative surgery, instrument, pathological specimens, x-rays and so on, operative surgery. So everything is there around 220 to 25 lectures. So please kindly go through that. Go through my website also, different versions, different lectures, brief lectures you can have in that. So students, I hope you have understood this lecture very well. Thank you very much.